Hi, my name is Cindy Knighton, and I'm the speech language pathologist at Speech for Success. And today I'm sharing with you an interesting question I get from parents often after they've already started speech therapy services, and that was wondering, when is it the right time to start speech therapy? And how do you know when it is time to look for a speech therapist? Well, today I'm going to share with you some specific milestones and things to watch for so that you can be more aware of when it might be the right time to start looking for a speech therapist. So let's look at the milestones first. Every child, of course, develops at his or her own pace. There's developmental milestones that your child should meet. And if your child does not meet them by a certain age, it could be a cause for concern. So, of course, one area, and the area we're focusing on today, is our speech and language development milestones. It's really important to be aware of where your child's speech and language should be, and if you are unsure, ask your pediatrician or doctor about that. So let's start by first looking at speech milestones. So as you can see here, I have a chart that gives an idea of the different age levels and what sounds they should be saying at that age. So for example, let's take the age of 2 here. By age 2, these are the sounds we would expect them to have in the beginning of words, or the initial position. The B, the P, the D, H, M, N. And then middle sounds, we have B, M, and N. And then, of course, final M and P. And as we get older, you see more and more sounds developing. And when we get to the age of 7, we'd expect them to have all of these sounds beyond here, as well as these current sounds that they have here. So like initial position, we see they have, the S blends now, the THs in the middle, and final. So that is a speech sound development chart, and that gives an idea of the milestones and the sounds we'd expect them to have at each age. Then, of course, we have our language milestones, and this is a cool chart I found that I will also insert a link to, and it has the different levels, different age levels, as well as what type of language we might be seeing. So here we have at 3 months, we might have some cooing and gurgling. Then let's jump ahead to 12 months. We should start kind of hearing their first words come out. And then let's skip over to 3 years. We see, 900 to 1,000 words and starting to ask short questions. So it doesn't go into extensive detail, but gives you an idea of how many words they should be having by now, and vocabulary, as well as, things they're identifying. So just a little summary of language development from 3 months to 5 years of age. So these are supposed to help give you an idea of what your child should be doing at specific ages when it comes to their speech and language. So of course, if you have concerns, it's, consult your pediatrician, and we'll go through that process now. So the referral process. If you suspect there's speech and language delays in children, they can be caused by many different reasons. But first, consult with your pediatrician to find if your child is reaching those milestones we just discussed. And if not, it's likely that your pediatrician can refer you to a pediatric speech therapist. Now, a speech therapist will help treat the children with communication challenges, both in how they speak and how they understand and use communication. So after the referral process is in place and you've found a speech therapist, the first step that they'll do is conduct an evaluation with the speech therapist to determine the challenges your child is facing. They'll then work with you and your child to create a customized plan to help them address the different issues that they're having with their speech and language. So, of course, it takes time to treat a speech and language disorder. And after your initial appointment and diagnosis, you'll then discuss with the speech therapist when you'll meet, how often you'll meet, and how long those sessions will be. So we'll jump over to the therapy bubble here and give an idea of what a therapy session will look like. If you have not been to one yet, this will be new, something you haven't seen before. So of course, each treatment session is going to look different for each child depending on their age and the particular speech or language challenges that are being addressed. So for example, a young child, a toddler through kindergarten, treatment's going to look a lot more like play, which is going to help keep the child engaged and interactive and wanting to work on speech and language. And as they get older, might do more work at a table, especially with specific articulation and language concepts that are being addressed. However, the goal is always to make treatment enjoyable, as this leads to better attention and internalization of skills. Make sure you ask your speech therapist about how you can help your child at home with exercises and activities to reinforce those new learned skills. Speech therapy is much more outside of the therapy room. The carryover happens at home, so it's essential that you find out what you can do to help your child in the home. All right. So the last step is the outcome. The ultimate goal for speech therapy is to help your child in their ability to understand and express their thoughts, ideas, and feelings, as well as develop intelligible speech so they are understood by others. In addition, it will give your child the tools to access their best communication potential and find their voice. I want to stress that these are just 2 areas in which a speech therapist can help. There are many others that we will address in future blog posts, but for now we're just focusing on their speech sounds and their language development. So that is a summary of when you might want to consider starting speech therapy. Thank you so much for taking the time to listen, and please don't hesitate to reach out if you have any questions.